Hello, my name is Dr. C.B. Ross, here from Body Best Doctors in San Juan Capistrano, California. Today, I will present one of my famous healing stories regarding a 4-year-old who stopped growing at age 4. The mother first consulted her child's pediatrician regarding the child's failure to grow. The pediatrician recommended growth hormone shots, which the mother declined and came directly to my office. In consultation, I explained to the mother stories I had heard about children's failure to grow while working at the National Academy of Child Development in 1982. The story is that some of these failures to thrive children in late puberty would suddenly die. The fact is, the synthetic drug disguised as growth hormone caused the child to grow. However, as the child reached late puberty, the child became very sick and died. Upon autopsy, the heart size was the problem. The heart size looked normal. However, when the heart was examined on the inside, the heart chambers were very small. As the child grows, the heart could not pump necessary volume of blood and oxygen necessary to sustain life. Following this explanation to the mother, she asked me what I would do if this was my child. I said, I have never had a case like this show up in my office before. However, I suggested we do a special tissue mineral evaluation called a hair tissue mineral analysis, where approximately 1 1/4 inch of the child's hair equals 5 grams from the nape of her neck. Obviously, a completely safe tissue sample specimen for the lab. The mother said that sounds easy and immediately agreed to proceed with the test. A tissue mineral analysis is the gold standard in the world for observing minerals inside our body. I use this test because it is a complete body mineral analysis, since the hair follicles are bathed in both the blood and the lymph. And its accuracy is much superior because it tests minerals by atomic spectrometry in parts per million, the most accurate test on the planet. Using blood analysis or urine analysis, incomplete, inaccurate, and not based on a complete tissue mineral analysis, and does not measure minerals in parts per million. Upon reviewing her young daughter's TMA returned report to my office from the lab, I was shocked with the documented test results. The tissue mineral analysis revealed the extremely high toxic aluminum present. I was somewhat perplexed, where a 4-year-old would have this unbelievably high toxic metal load present in her body. My research revealed a possible explanation. I discovered Pepto-Bismol was the highest aluminum content of any product on the market mentioned earlier. The mother and daughter scheduled a follow-up consultation appointment at my office. In consultation, I looked at the mother and specifically asked her, have you ever given your daughter Pepto-Bismol? I could tell from the look on her face, she seemed temporarily stunned by the question for several seconds. She did not even blink before answering my rather simple question as I stared at her, waiting for her response. She finally looked at me and said, yes, my daughter had a serious stomach pain problem, and so I carried the Pepto-Bismol in my purse to give her when her stomach would hurt several times a day and before bedtime. I then explained to her Pepto-Bismol is the highest aluminum product on the market. She wiped her eyes, attempting to hold back her tears of remorse. She now felt bad in discovering she was the cause of her daughter's failure to grow, as she automatically placed both her hands over her heart and started crying, realizing she was the real cause of her daughter's problem and failure to thrive. I then told her the good news, explaining how EDTA suppositories will easily remove all the aluminum from her daughter's body. In my consultation room, which is also my private office, I had a large periodical chart of elements on the wall. I stood up and pointed directly to the chart to assist her to understand my discovery with her daughter. Aluminum is number 13 on the periodical chart, located in the family 3A group, just underneath the essential mineral boron, number 5. I explained the mineral boron is known to run the pituitary gland, controlling growth and sexual development. Aluminum is classified as a toxic heavy metal that displaces the lighter essential mineral boron off its receptor site on the pituitary. The high aluminum shut down the function of her daughter's pituitary gland at age 4, and her daughter's body automatically stopped growing. The patient's failure to thrive is now solved. I said the gold standard in the world for chelating heavy metals out of the body, including aluminum, is by EDTA. I said I have the natural EDTA suppositories made for children. I prescribed EDTA suppositories. Suppositories are much less expensive and work much better than IVs because entry into the bowel, EDTA is delivered directly into the liver, the master organ of her body. From there, it is able to enter through the blood-brain barrier into her brain, reaching her pituitary to chelate the aluminum out. I recommended 8 EDTA suppository treatments that are every other evening just before bedtime to remove the toxic heavy metal aluminum from her pituitary gland. She quickly agreed. In 30 days, she returned to my office. She quickly blurted out with extreme joy that her daughter had already grown 3/4 of an inch. Wow, I said. I just gave her a great big hug, and then we held hands, jumping up and down like 2 little kids playing ring around the posies, followed with another big hug of joy together. Yes, the mineral boron returned to its proper receptor site in her pituitary, and her little daughter started growing in just 2 weeks. This is presently perfectly developed in height, weight, and sexual development. 14 years later, she's perfectly developed. EDTA stands for ethyl diamine tetraacetic acid. EDTA also protects you by reducing risk of heart attacks and strokes. It reduces the need for bypass surgery and reduces your blood pressure. It removes calcium from your heart valve, and calcification involves your heart function. Current EDTA research assists with impotence and vision problems, such as macular degeneration and glaucoma. Chelation can treat and or prevent many serious diseases, including pancreatitis, gout, both rheumatoid and osteoarthritis, chronic fatigue, irritable bowel, Alzheimer's disease, multiple sclerosis, and cancer. How does it work? Chelation comes from the Greek word claw. It works by binding heavy metals such as lead and mercury, then removes them through the kidneys in the urine. Thank you for listening. Click the subscribe button on your screen so you will not miss any of Body Best Doctor's videos. Any questions, call 949-661-9476. Thank you.